Hello everyone. Now I will be discuss our research introduction in our study entitled Challenges in the Delivery of Social Services for PWDs in Barangay Lazareto. So first, let us define what is disability. So disability can be defined as the loss or limitation of the opportunities to take part in society on an equal level with others due to the social and environmental barriers. So, according to Government Survey Report 2021, it can also be defined as a physical or mental impairment which has a substantial and adverse effect on a person's ability to carry out normal day-to-day activities. In recent times, many challenges faced by people with disabilities in accessing social services may not readily apparent. This study aims to shed light on these challenges and explore ways to assist individuals with disabilities in our country. So according to Journal for Philippine Association of Institutions for Research or JPAIR, states that people with disabilities are one of the concerns of society, but due to prejudice, they are put in a disadvantageous position. So maybe the reason is disorganized or ineffective communication among various offices that offer assistance to people with disabilities, a lack of understanding about the specific needs of the local PWD population, and insufficient funding to supply the necessary materials or services for them. Earlier, we defined about disability, and now we define what is a barangay and what is their role in the community. So, barangay is the smallest administrative division in the Philippines, and the goal is to serve and provide basic services to all people in their areas. However, it is known fact that some barangays encounter difficulties in delivering social services effectively, particularly to those in need. Among these are the people with disabilities who have the unique needs and face distinct challenges. More regard and assistance from society are needed for them. Social services for people with disabilities play a crucial role in promoting inclusivity, equality, and support for individuals with disabilities. These services aim to provide assistance, resources, and opportunities for PWD to improve their quality of life and participate fully in society. So, the 2030 Agenda for Sustainable Development pledges to leave no one left behind. So, we should promote inclusivity in our community. So, when we say inclusion, so it's about creating environment where everyone feels welcome, supported, and respected. So we should work together to create a work where everyone can thrive and feel included. Barangay Lazareto, which is one of the 62 barangay in Calapan City, with a population of 4,799 as of 2020. That is located in the coastal area of Calapan City, and its main source of income is fishery. In Barangay Lazareto, there is currently no dedicated office or staff specifically assigned to handle PWD affairs. As a result, individuals with disabilities rely on the Barangay Health Center and the City Social Welfare Office to address their needs. While these existing resources play a crucial role in providing support, it highlights the importance of establishing a dedicated office or personnel within the barangay to cater specifically to the needs of the PWDs. This would ensure more focused and efficient assistance for individuals with disabilities in the community. So people with disabilities in Barangay Lazareto face many challenges, including a lack of opportunities for education and participation in community activities. So many challenges, and the quality of services available to them may also be inadequate, hindering their access to essential healthcare and support services. So, in addressing these challenges, requires concerted efforts to promote inclusivity, raise awareness, and provide support and opportunities for individuals with disabilities. The emphasis on inclusivity becomes more important in light of the difficulties in delivering social services for individuals with disabilities in Barangay Lazareto. Stakeholders, local communities, and government agencies must work closely together to create an environment that is more accessible and inclusive. We can guarantee that every individual, regardless of their ability, may fully engage and thrive by addressing this obstacle. The aim of this study is to identify and comprehend the obstacles that prevent efficient service delivery in the context of social services for individuals with disabilities in order to contribute to the improvement of the situation and well-being of people with disabilities in Barangay Lazareto. This research conducted at Barangay Lazareto, Calapan City. It aims to explore the challenges faced in the delivery of social services per person with disabilities in this specific barangay. So by identifying these challenges, we can work toward creating more inclusive and effective social services for PWDs in our community.
Statement of the problem. In the statement of the problem that help to answer our objectives that what I aiming to do in our research study. The general problem of the study is the challenges in the delivery of social services for PWD in Barangay Lazareto. The study aimed to determine what are the possible interventions in the problem. Specifically, it seeks to answer the following questions that help to answer the research title. Number one question is, what are the challenges in the delivery of social services for people with disabilities in Barangay Lazareto as perceived by barangay health workers in terms of accessibility, barangay initiative, healthcare access? Number two question is, what are the challenges in the delivery of social services for people with disabilities by themselves in terms of accessibility, barangay initiatives, and healthcare access? Number three question is there a significant difference between the views of BHW and PWD in the challenges of delivering social services for people with disabilities in Barangay Lazareto in terms of indicators? The significance between BHW and PWD on the challenges of delivering social services for people with disabilities are fairness of receiving services, quality of services, and community support.
For the significance of the study, the various beneficial are the following.
Parents of individuals with disabilities will benefit from this study as it provides them with the necessary resources and support to care for their loved ones. This will help alleviate some of the challenges and concerns they may face in their caregiving role. Additionally, the community will benefit as they are the one providing social services to disabled individuals. By contributing to this study, they can foster acceptance, inclusion, and create a more accessible environment for everyone. People with disabilities themselves will greatly benefit from this research as it aims to enhance their quality of life, independence, and overall well-being by providing them with the support, resources, and opportunities they need for growth and development. Furthermore, future researchers will benefit from studying the delivery of social services to individuals with disabilities as it can provide valuable insights and knowledge to inform and improve policies and practices in the field of disability services, leading to more effective and efficient services in the future.
Scope and limitation. The study focused on the difficulties of people with disabilities in Barangay Lazareto and accessing the social service. The assessment covered the accessibility and barangay initiatives and healthcare access. The study was limited at 30 persons with people with disabilities, and the instrument will be distributed by the month of March 2024 in Barangay Lazareto.
In this research, we create a conceptual framework to guide to understanding and evaluating a problem or issue. In our research, we have two variables. It is the independent variable and dependent variable. Our independent variable are accessibility, barangay initiatives, and healthcare access. And our independent variable are fairness of receiving services, quality of services, and community support that helps to study and investigate the challenges encountered in the delivery of social services in Barangay Lazareto. By this factor study aims to provide a comprehensive understanding of the barriers to the delivery of social services in Barangay Lazareto and offer insight for potential improvement in the barangay for PWD.
Hypothesis 1. There is no significant difference between the delivery of service satisfaction and challenges in the delivery of social services and accessibility, barangay initiative, and healthcare access. Hypothesis 2. There is no significant difference between the views of barangay health workers and people with disabilities on the challenges of delivering social services in Barangay Lazareto in terms of fairness of receiving services, quality of services, and community support.
Theoretical is the basis for research. It is motivate for academic to pursue social science studies. Theoretical hold the truth about the study in community and social services in social model theory. We have two theory constructed. First is social model of disability, and the second is ecological system theory. So what is social model of disability? Social model disability is a framework that focuses on how society create barriers for individuals with disabilities. It is a premise on the concept of operation. According to Aberle, cited by Anastasio and Kaufman, 2013, disability is something imposed on top of the disabled. It is isolated and excluded from full participation in society. In this context of social services, the social model of disability theory suggests that the focus should be addressing in their environmental and societal factors that hinder the full participation of PWD. By applying this theory in our study of social services to people with disability, we can help towards creating a more inclusive and equitable society for people with disabilities, and removing barriers and promoting equal opportunities for all individuals regardless of their abilities.
The modern application of the ecological system theory is based on 5 presumptions that examine the interaction and interdependence of systems. It emphasizes that one system cannot be evaluated in isolation but must consider its impact on other systems. Applying this theory to social services for people with disabilities allow us to explore different scenarios. In microsystem, these scenarios include understanding and supporting the specific needs and preferences of people with disabilities within their immediate social circle. In mesosystem, coordinating and collaborating among various stakeholders. In exosystem, considering programs, laws, and regulation related to disability rights and services. In macrosystem, examining societal attitudes and values towards disabilities. In chronosystem, recognizing the changing nature of disability rights and programs over time. By considering this aspect, social services can ensure equal access and comprehensive support for people with disabilities. Ecological System Theory by Mr. Bronfenbrenner is a valuable framework for social providers to determine the best system to intervene based on their assessment. This theory promotes the inclusion of people with disabilities in the community. By implementing this theory, desired outcomes can be achieved, including better social inclusion of PWDs. The theory emphasized the interconnectedness of social and environmental influence such as family, school, community, culture, and belief system, which greatly impact on individuals' development. To achieve better inclusion in society, it is necessary to bring about changes in these factors. The ecological model is a powerful tool for promoting the social inclusion of PWDs. It highlights the importance of addressing the demands of PWDs and the significant contribution of individuals interpersonal, organizational, community, and interpersonal factors. An empowerment model is needed to effectively integrate PWDs into society. Unfortunately, services for people with disabilities have often been undervalued compared to those for others. The ecological system theory examines the interaction between different components of society and emphasizes their role in maintaining stability and health. By utilizing this theory, better results can be attained.
Here are the legal bases connected to our study. First, Republic Act number 4373, or the Regulating the Practice of Social Work in the Philippines. This law establishes guidelines for the practice of social work within the country. It ensures that social work agencies operate under proper registration with the Department of Social Welfare and Development, or the DSWD. So by regulating the profession, the Act aims to maintain professional standards, ethical conduct, and competence among social workers. It emphasizes the importance of trained professionals in addressing social issues and promoting social justice. Additionally, Republic Act number 7160, or the Local Government Code of 1991, it empowers LGUs to provide essential services and facilities to their constituents. It promotes community engagement, responsiveness, and accountability in social delivery. However, Executive Order 15, or the redirecting the functions and operations of the DSWD, outlines the mandate, roles, and functions of the DSWD, the primary agency responsible for social welfare and development. The order guarantees that social programs are properly coordinated, monitored, and implemented by outlining the DSWD's responsibilities. It demonstrates the department's dedication to empowering people in need and developing social fairness. Moreover, in Republic Act 9442, or the Magna Carta for Disabled Persons, this law addresses their unique needs, promotes their inclusion, and safeguards their dignity. The Magna Carta acknowledges that disabilities should not be a barrier to living a full life. Inclusion promotes compassion and fairness in society. However, challenges still exist, such as ensuring adequate implementation and promoting awareness about PWDs.
Review of related literature and study. These are the findings of two studies regarding challenges in service delivery. According to Turner et al. 2018, they identify the various factors affecting service delivery outcomes, such as infrastructure, cultural norms, government structure, and resources availability. Particularly within non-profit organizations, these factors influence how effectively services are provided. In relation to Barangay Lazareto, it's one of the problem are the infrastructure, resources, and also the lack of funds to support the PWD in delivering of social services. They highlight the issues of lacking integrations among stakeholders, policies, communities, members, and services providers, which can hinder service delivery. In addition, the second literature, according to a study of Bandoy Chin et al. 2018, point out that the complexity of service and the involvement of multiple service providers have led to fragmentations problem. These fragmentations within non-profit social service often result in failing to meet client needs and an efficient use of resources. They propose that frequent monitoring and evaluations can help maintain standards and identify areas for improvement. Overall, both studies emphasize the importance of addressing these challenges to improve service delivery effectiveness in relations to our study. It helps to in our research study because through the informations of Turner et al. And Van Doyen 2018, we know that the problem of delivering social service for PWD are existing.
Foreign literatures. Inclusion of students with disabilities according to Al-Hadi A 2021 revealed challenging facing the inclusion of people with disabilities in Egypt, such as first, lack of in and pre-service training of teacher; second, limitation of constructions and preparations; third, lack of coordinations and ministries; fourth, limited program for students with certain disabilities; then fifth, lack of awareness in the community and the family. The study concluded that the successful inclusion of people with disabilities mainstream in the School of Egypt, such as universities, considered inclusive educations when training the education of teachers, the professional development of the teachers, then inclusive education's requirements, inclusions for people with disabilities that not be limited by these services. Related literatures in Bangladesh. According to Karki et al. 2021, the problem of people with disabilities in Bangladesh is first, lack of awareness challenges to get the assistive device by the people with disabilities. Second, lower knowledge about ads to compare a service provider. Then third, top down policy in the country. Four, unaware the needs of people with disabilities. Then fifth, lack of service, found of lack awareness according to Emam et al. 2021. So most of the time, assistive device means only the wheelchair to them. Their life must be complicated with the assistive device, so people with disabilities have an lower knowledge. According to Borge and Ostrijan 2015, the people with disabilities are illiterate about the benefits of ad and also the source of getting device. While according to Karki et al. 2021, Emam et al. At 2021, Borge and Ostrijan at 2015, assistive device are the technology is useful to people with disabilities that reduce the needs for formal healthcare issues.
Next is methodology. This chapter describes the research method and procedures, techniques, and sources of data that help the researcher for further data gatherings. It includes the research design, respondents of the study, research instrument, and data gathering process, data analysis procedures, and ethical considerations.
Research designs. The study used a mixed method combining both qualitative and quantitative research. So when we say qualitative research, it is the conducted to explore the challenges individuals with disabilities face by accessing a social service within their communities. In this study, involved with the depth interviews and document analysis, certain comprehensive understanding of the issue. While when we say quantitative research, it is involved the use of the survey to gather the numerical data and difficulties experiences of the individual with disabilities when accessing social services in their communities. So it is the collected or measurable data analysis to identify pattern, trends, and correlation.
Population and sampling. This study will be conducted on the Barangay Lazareto, Calapan City. The respondent of the study were the 30 individuals selected from Barangay Lazareto, included the people with disabilities, barangay officials, and the parents. There are the representative of populations to answer our question surveys in our research. We're adopting a total population sampling approach, a form of purposive sampling where we included the entire populations of interest in the study. This method is chosen due to the relatively small population size, enabling us to comprehensively study and gather insights from all relevant individuals in Barangay Lazareto.
For data gathering procedures,
To collect all the necessary data, the researchers will follow these steps. Firstly, an endorsement letter will be obtained from the research professor. Secondly, after the endorsement letter received from the research professor, a consent letter will personally deliver to the barangay captain of Lazareto. This letter will consist of a requested permission to conduct the study within their community and outlining the purpose and potential benefits of the research. Before the respondents begin answering the research questionnaire, the researcher will explain the directions and the objectives of the study to ensure the clarity and understanding. Lastly, after the respondents complete answering the research questionnaires, the researcher will collect the answered questionnaire for data analysis.
For our data analysis, we will use 4-point Likert scale for the questionnaires. This is a type of scales in research questionnaire to allow the researcher to include 4 extreme options. These Likert scales answer by the respondent without being unbiased on a particular subject market research. The researcher could ask the respondents who are selected to rate the questionnaire made for challenges in the delivery of social services for PWD. On a scale from 4 highly satisfaction to 1 very low satisfaction. Also, the researcher will use thematic analysis, qualitative data analysis technique. It will entail reading through a dataset, transcript from in-depth interviews, and spotting patterns in meaning across the data to drive them.
Next is sources of data. The researcher will use a self-made questionnaire and the Likert scale as the instrument to gather the information needed in this study. The questionnaire was composed of 12 items per indicator on the challenges in the delivering of social services in Barangay Lazareto and 8 items for the Likert scale that will be answered by PWD's respondents. And that's all for our chapter 1 to 3 for our research proposal prepared by Group 5.